Alrighty gang, so I got the go ahead to make a video instead of using pictures and stuff, so I'll just put it at the front of the PowerPoint and you guys can just, like, you'll have started it and follow along. So I'll go through the inhibit, the activate, or the inhibit, the lengthen, the activate, and the integrate. So I will just run through the PowerPoint with the signs and symptoms, and then I'll get going and I'll make a video of it. I'll attach as much as I can find for the physiotech document, but I have been having trouble finding a lot of the self-myofascial release and some of the exercises and stuff. So I'll add in the most I can. Okay. So this is the PowerPoint, CES for lower extremity. So I chose plantar fasciitis. It's typically caused by increased shocks on the system, and it's an incorrect means of shock absorption. This can be due to repeated impacts, so if you're athletic and you start a new sport or have been doing it for a long time, or it can be due to increased weight gain from pregnancy or just eating too much or anything really, or it can be a mixture of all three. So signs are flat feet and fallen arches. I personally have very flat feet. I have little hobbit feet going on. So this is going to be beneficial for me anyways. Symptoms, it's heel tightness, really tight ankle complex, and heel pain from plantar fasciitis. And this, in people, it can range from very dull to very intense pain. And the pain is typically more prominent after you've been sleeping or sitting or just periods of rest. Okay, so the movement assessments I would do would be static posture, and I'd probably see feet flattening and turning out. So this, from the book I was reading, that it helps determine the basic type of foot, and there's like a normal arch, then there's planus, which when you add weight your foot flattens out, and there's pes cavus, where you actually have too much of an arch, and this can help narrow down the source of the flattening and rotation, and if it's natural or unnatural. The overhead squat, this one's really good because even if they have pain, it's a pretty simple movement. It will make movements more excessive. You'll likely see the foot flattening, knees rotating, you might see hip movement, and it can be done, yeah, like I said, it can be done by anything. And you'll likely see the tight ankle complex. This one, you'll see knee movement, and you'll want to get out a 2x4 to take the tight ankle complex out of the equation and see if the problems are actually stemming from the hips or the ankles. And it's, for this purpose, we'll just say ankles. Single leg squat, it's good to see how far the problems have spread to, even after the 2x4 example. So you'll see weak hip muscles and movement. You might see hips drop. For the purposes of this, we'll just assume everything is fine, but it just stems from the ankles. So gait 2, you can watch for foot and hip movements. This is more about a sensory motor deficiencies, I'm seeing that in their movement. And the manual muscle testing, if they struggle with any of them, this is going to be the go-to, depending on their pain and intensity. I didn't do the less assessment or any of the jump ones because that could be quite painful. The single leg squat one might be quite painful too, so we'll have to keep in mind their pain this entire time. To reassess, I would do the postural assessment, the overhead squat assessment, single leg assessment, and gait assessment again, just to see, to quickly run through it and see if they've improved. And if I could, I would try to progress to a less test, but that might be quite a while down the road. Okay, so I'll get started doing the inhibitory part of this. Alright, for inhibiting, I personally like to start from the feet and work my way up. The muscles I want to inhibit would be the soleus, the gastrocnemius, the perineal complex, the biceps femoris, especially the short head right here, the vastus lateralis, which is the side here, the adductor complex, and the TFL right up top here. So, starting with the soleus, which is lower, the easiest way to SMR this is to just put your ankle on your calf on the foam roller and slowly roll it back until you find a tight spot. If you go up too high, like you're going to be getting the calf, the gastrocnemius in here too, so you might as well start from the bottom and roll your way up, get both of them at once. Try to emphasize the lateral side of your gastrocnemius. Okay? If you feel that's not enough weight, you can stack your legs, roll till you find a spot, and then hold it. Even if you just want to use your body weight. Okay? So you'll do that, you'll find the spot, and you'll hold it for 30 seconds for intense pain and 90 seconds for moderate pain. Then, for your perineal, it's when you flex, your perineal is the muscle that runs right anterior to the soleus and calf. So you're going to roll the ball all the way up in that little groove there. So, an easy way to do it is to just find the groove. Okay, it's easy to flex there. And then you're just going to want to stack your legs. Push down. You don't want to roll in this one. You just want to see if you can find a trigger point. And you just want to work your way down the entire groove. Okay? So push as you need. If you can stack your legs, add weight. Okay? You can also do this with the foam roller, but I find since it's so deep to the soleus and gastrocnemius that you might as well use the lacrosse ball, because I don't feel anything when I try doing it with the foam roller. So you can use the lacrosse ball, you can sit up with your leg underneath you, just find that groove, and then just push down and add some pressure. Okay? It will help you get deeper. The smaller the modality, the deeper you'll get into your tissue, right? Alright, so the biceps femoris. So this one, I prefer to use the lacrosse ball just to get deeper, but you'll focus on this part of your muscle here. So on the lateral side of your hamstring, and I like to start up high, okay? And then you just sit and relax into it. And I want you to just zigzag up, probably a dozen times, up the right half of your leg. Okay? Really try to emphasize the first half. Okay? If you don't find anything, just keep moving. But just add some weight. And once you find a trigger point, hold that for 30 seconds like all the other ones. Okay, so you'll work your way all the way from your glute all the way down, just on the one half, but really focus right here. Okay, then we have the vastus lateralis. This muscle, it's all up the side of your leg, and it actually, the IT band just runs over it. So to avoid the IT band, because that might really hurt from some people, I want you to avoid like your pocket area and just focus right on either side. If you really want to avoid the IT band, you can take your lacrosse ball and run up either side of your leg. For time purposes, okay, you want to just put your hand in front for support, your foot for support, and then you'll just run. I like to twist forward, rotate forward to get the front side, and then rotate back to get the other side. Okay? It's not about getting your IT band, it's about getting the muscle underneath it, right? See right there. And then you want to hold that for 30 seconds. Okay. The next one is the adductor complex. This one's pretty basic. So you'll kick your knee out to 90, and just avoid the groin. You don't want to get too far. But you'll just roll till you find a spot. And then once you can relax and just hold it for 30 seconds. Okay. And similarly, we'll do the tensor fascia latae. Okay, the easiest way I can describe it is to, it's basically where your pocket goes, but you'll put it right below your hip bone, not on the bone, but just below, and then you'll just roll over. Okay, and then you just kind of relax into it like your groin muscle. This one's a small muscle, so you might only have to move it once or twice or 3 times, but do what you can. You can even just roll on this one, it's not too bad. But feel free to just sprawl out and put all your body weight on it. It should be quite tight. Okay. All right. So now it's time to lengthen the inhibited muscles. So to start with the peroneals and the soleus, I kind of mixed 2 stretches together. So on one side, you're going to sit back on your foot that's pointed medially towards the center of your body, right? And then you're going to kick this foot back, push it forward, and you're just going to keep your bum on your back foot, and then twist your body and try to get more of a stretch out of this leg. Okay, you want to keep your heel on the ground and just stretch both as far as you can. Okay, remember to try and sit all the way on your foot to keep that pressure. Okay, and then you'll hold that for 30 seconds. So this stretches the soleus and the peroneals. Okay, oh, sorry. So then we have the gastrocnemius. This is an easy one. So you'll just come up to the wall, put your foot up to about a 45, and you'll just bring your hips towards the wall, and you should feel quite a stretch in your calves. Okay, and then you just want to hold that for 30 seconds. Okay, then you have your hamstrings, your biceps femoris. So you'll want to relax your other leg, and you'll just pull your leg up, trying to keep it as straight as possible and right perpendicular with your body. Okay, as much as you can. You want to hold that for 30 seconds. Okay, and then for the vastus lateralis, same exact movement, but then I want you to pull it over to the side. Okay, and then go as far as you can while keeping your leg nice and straight and your hips flat and neutral, and hold that for 30 seconds. All right. All right. For the adductor complex, sit right up to the wall with your bum right close to the wall. Okay, and then I just want you to spread your legs as far as possible and just hold it. It is quite the stretch. If you want, your bum can be right up against the wall. Okay, so you hold that for 30 seconds. Okay, then we have now we have the vastus lateralis stretch. So you'll just do the standard quadricep stretch, right? And then you'll try to pull it out to the side just slightly. So instead of being straight back, it's just slightly out to the side. And then I just want you to hold that. So 30 seconds. Alrighty, so now we get to the good stuff. We're at the activation of the underactive muscles. So in the ankle complex, there was the middle gastrocnemius, and then the anterior and posterior tibialis. Okay. So the gastrocnemius is easy. It's basically just a calf raise, the medial gastrocnemius. So you'll just lift off your feet, hold for 2 seconds, and then go 1, 2, 3, 4, back to neutral. You can do this on stairs, on a tire, you can do it weighted, unweighted. For the tibialis muscle, okay, you're going to start flexed in dorsiflexion. Okay, and then you'll go 1, 2, and 1, 2, 3, 4. Okay, then you'll pull back 1, 2, 1, 2, 3, 4. And that's how you'll work the tibialis. All right. So for the activation of the hamstrings, I had to get a bit creative with the resistance band and a K-band, just looped in so it's a bit more comfortable on my ankle. So the first one is going to target the hamstrings, the glutes, and the sartorius. Sartorius basically just kicks your leg out of extension. That's like its main job from what I've been able to read. Okay. So for this one, you're just going to stand upright, and then you're just going to flex all the way back to 90 degrees. Hold it for 1, 2, and then 1, 2, 3, 4. Flex. 1, 2, 3, 4. Try to point your heel to the ground. You should feel your glutes activate slightly more. 1, 2, 3, 4. Okay? And then for the other side, for the gracilis and popliteus, you'll do a similar movement. So you'll spin around your thing. So you'll raise your knee to 90, okay? And then you'll just point your foot as far forward as you can. Hold it 1, 2, 1, 2, 3, 4. Okay, go back down. So up. 1, 2, 1, 2, 3, 4. I'm struggling a bit. Try to keep your knee right up to 90. Okay, so up. Oop. Pointing forward. 1, 2, 3, 4. Okay, it's going to be similar movement. For the TFL, you're just going to basically try and curtsy. Okay, so you'll pass it behind you. Okay, hold it there. 1, 2, 1, 2, 3, 4. Okay, so curtsy. 1, 2. Try to keep your foot off the ground. 1, 2, 3, 4. Back to normal. Okay. And you'll just keep doing that. Okay, for the adductor complex, same thing, but you are going to go in front of your body instead of behind. So you'll cross over, okay? 1, 2, 1, 2, 3, 4. Okay? 1, 2, 1, 2, 3, 4. Perfect. So that's all the activation. I mixed a few muscle groups in to make it more suitable for my client. Alright guys, so I chose 4 exercises. The first one is skipping. It's only in the one plane, but I'm focusing on the quick activation to get the gastrocnemius firing. It fires better under the quick actions than it does just the slow, like standing. It's not very much used for standing. So skipping, I just want to see quick movements. Okay, I'll have them doing this for a minute. It will warm up their muscles. Okay, so pretty basic. Good cardio, gets them going. Okay, then it will be the lunge complex. So this gets the hamstrings and glutes firing. It's more of a proprioceptive challenge. You'll also get some ankle complex activation. So you'll start 90 degrees in your leg, your back knee close to the ground, and then on the upswing, you'll use the force generated from your legs to toss up the kettlebell, and then you'll switch arms and come back down. So it looks like this. So you want to do these as fast as you can control them. You want to at least go to eye level. Okay, so it's a good multiplanar movement, and it's proprioceptively quite challenging. For the landmine complex, this one, you're going to have a split stance. Okay, you're going to put your grip on the opposite hip. Okay, and then you'll go into a clean, and then switch and back down. So up, back down, up, back down. So that's a good one for balance. It's proprioceptively challenging. And I also have a couple other facts there, but a little bit out of breath, so it's harder to think. Okay. This one, you're gonna go quite far from the wall, okay? So you're gonna pick one side. So if my right side's extended, I have the shot put on the right side. So you'll hold it just like you would a shot put, okay? So then you'll bring your knee up to 90, you'll kick back, wait for the force to transfer, and you'll push the ball into the wall as hard as you can, okay? Just like you would a shot put. So, up, okay? So it's a slow, controlled movement. I wanted to see you have control the whole way through, especially the phase after you've thrown it. So you go up, kick. The key is to wait for the force to transfer through your body and use your kick back as a lot of the momentum. If you push too early, it's all your arms. So it's all about timing. So you'll kick, and it should be quite a hard throw.